so that they too can get knowledge about it. Today, in this video, we are going to talk about Lugway. What is the type of Lugway? Why is it there? What is the reason for it? Why does the strength of the hands and legs go away, and how can we fix it again? So the word Lugway, we can also call it paralysis. And what happens in Lugway and paralysis is that the strength of one or multiple parts of the body goes away. It can be your hand, it can be your hands and feet, it can be your voice. That is, if any part of your body stops working, then we can call it paralysis. Now there are multiple reasons for this paralysis. And the biggest reason is brain stroke. Now we will try to understand what brain stroke is. Your brain is running your whole body. What are you seeing? What are you listening? How is the weather? How many hands do you have to walk? Are you holding things? Are you leaving things? Your brain controls every movement in your body. If your brain has any type of damage, then we call it brain stroke. Now it is necessary to understand what are the things that damage the brain and how it happens. To keep our brain working constantly, a constant blood supply is required, because when blood is coming, it is bringing oxygen with it. It is bringing food, it is bringing strength. Only then our brain is able to work. If for any reason, there is a blockage in the blood supply, then we get brain stroke. Now the supply of the brain can be hampered in two ways. If any type of clot comes into the blood supply of the brain, and the blood supply of the brain stops somewhere, then a part of the blood does not reach. Not reaching blood means oxygen does not reach, food does not reach. And that part of the brain dies within the next 4 hours. In the same way, if you know that the BP is very high and a nerve breaks in your brain, then what will happen is that blood will flow inside the brain and damage a part of the brain. And as I said before, if any part of the brain does not get oxygen, does not get blood, does not get food, then it dies within the next 4 hours. Now that part of the brain that used to work, will it be able to do it now? Because the part of the brain did not get food, it is dead, it is damaged, there is swelling in it. Because of this, the part of the brain that used to work, that is running your heart and lungs, giving voice, giving the power to understand things, your emotion control, it starts getting hampered. What do we see in the patient's body? That his ability to work has gone, so it looks like the hand is not working or the foot is not working, but the problem is not in the hand and foot. The mass of the hand is fine, the bone is fine, everything is fine, but the part of the brain that runs the hand, it is dead, it has been damaged. So if we classify any paralysis patient that what type of paralysis happens, then mainly brain stroke. There are two types in brain stroke because of a clot, which we call ischemic brain stroke. The other type of damage is hemorrhagic brain stroke, where blood has flowed into the brain, the anus has burst, that is hemorrhagic brain stroke. In the same way, there is spinal injury. Suppose someone has an injury to the back, then the lower part of the injury will be paralyzed. In the same way, if someone has taken poisonous consumption, suppose someone has taken pesticide, insecticide, or taken a drug that damages the nervous system, then it is also called paralysis. But 95% of the cases of paralysis are due to brain stroke. That is due to a clot in the brain or due to a burst of nerves in the brain. Now it is important that how can we bring rest to these 95% patients? Now if a part of the brain has been damaged, then the first 4 hours are very important. If we get the right treatment within these 4 hours, suppose a clot came in the blood supply of the brain, if that clot dissolves, then the patient will not be able to harm. Because of this, if someone feels that paralysis is happening, then he should go to the hospital quickly and take the medicine to dissolve the clot, so that the clot comes out and the patient has minimal damage. But not everyone can be so lucky. If you miss this 4-hour window, golden hours, then the paralysis takes time to heal. If the brain has been damaged and the person watching this video may also have paralysis, then when someone has paralysis, then within the first 6 months the patient gets a very fast recovery. Now it is important that how is this recovery happening? So if there is any wound or injury in our brain or body, then our body tries to fill that wound on its own. Suppose you have a cut on your skin, then what will happen? It will fill up. We just have to keep it clean, and the wound will fill up on its own. In the same way, when there is damage in our brain due to the clot, or due to brain hemorrhage, then the brain also tries to recover itself. And this effort is called neuroplasticity. That is, when someone had paralysis, then his condition was very bad. He was not able to get up, sit, speak, or walk, but in the next month it improved. In the second month, it got better. In the third month, it got better. In the fourth month, then the speed starts to decrease a little. And by the sixth month, the paralysis that was getting better, it stops while getting better. If your recovery is complete in this, then there is no problem. But the maximum patients are those who miss this period. So the answer to this is neuroplasticity. Now, what is neuroplasticity? It is a mechanism to fill the damage in the brain, in which the bypass of the damaged part is made, so you bypass. For example, in your city some roads are closed, there is traffic jam. So what happens? Cars start leaving from there. In the same way, if a history is damaged in our brain, then the electrical signals that our brain sends to control our hands, we have to bypass that part. And the mechanism to make this bypass is called neuroplasticity. Now, this neuroplasticity, as long as it is in our brain, will allow us to see improvement in our body. That is, the symptoms of paralysis that we see will continue to decrease. That is why, in the first 6 months, we see that neuroplasticity is working very fast. The ability of the patient to recover starts coming very quickly. But there is only one problem with this neuroplasticity: it lasts for a maximum of 6 months. After that, it starts stopping automatically. So, what we see is that after 6 months, there is no improvement in the patient. If we want to restart such a patient where 6 months have passed and improvement has stopped, then it is very important to restart this neuroplasticity. Because as soon as neuroplasticity starts, the patient's improvement that was not happening will start happening. Because when there is no improvement in the patient, he is getting physiotherapy, taking all the medicines, but he is not seeing any changes in his body. But as soon as he starts the treatment of the right neuroplasticity, then that same exercise, that same physiotherapy starts working. So if we want to cure any paralysis, then we have only one way, that is neuroplasticity. If we work on neuroplasticity, if we give nutrients to the brain, if we train the brain, then our lost ability starts coming back. Now, the special thing about neuroplasticity is that you can start it at any time. It doesn't matter how old you are. It doesn't matter if you are 10 or 11 years old, it doesn't matter. To start it, you just have to understand your brain well. What are its requirements? What does it need to be cured? And how does our brain work? If you solve these 3 things, then you can see recovery very quickly. Now I want you to meet the patient and understand how a 10-year-old patient shows recovery in himself. So, you have not lost your courage. So, you have seen that even 10 to 12 years old paralysis can be cured. But, it is important for you to start neuroplasticity in the brain. And, to start it, you have to work hard. What does hard work look like? It looks like the right exercise, the right diet, and the right medicine. I hope that this video has helped you understand the difference between paralysis and neuroplasticity. Do share it with your friends and family members, so that they too can get knowledge about it.